Andre, what is NHI all about?
Dingie, it's a process or funding instrument that government wants to ensure that we provide access to the whole population for quality healthcare, where people are not denied access because they don't have the ability to actually pay for their healthcare.
Okay. And what is AON's view on NHI?
AON is exceptionally supportive of the principle and the objectives. It's a basic human right. There's nobody that can fight against it. And AON's view is also that we need to contribute positively in terms of advice, guidance, and labour in making sure that we make a success of NHI. You see, we have two choices. You can either sit on the fence, or what we can do is we can actually make a positive contribution and be part of the solution or be part of the problem, but be part. And I think that's what AON wants to do.
Okay, that's great. And do you think that NHI is good for South Africa?
That's a good question. I think let's look at it differently. And I want to share a story. I call it the dream of a child. And the Nelson Mandela Children's Hospital they're busy building it. It's going to be state of the art with an enormous amount of good equipment, exceptional competence in staff. They even have facilities where the parents can actually sleep over and be with the kids. Rehabilitation systems, telemedicine. If there's a person in KwaMaslangu in a rural clinic, they can actually link up to this hospital and speak to the professor and actually get good quality of care. Now you're a mother.
I am.
And would you want to take your child to a facility like that?
No. I would. I definitely would.
You would definitely want to take your child there. And if I was a child and if you were a child, you would want your parents to take you there.
Sure.
Now this is a facility that will cost very little to the taxpayer. It's built with global fund money. And it will challenge then the private sector in terms of how do they now compete, because they now need to compete on cost and they have to compete on the quality.
Absolutely.
That is an interesting phenomenon. Now, think about how it will now change the dynamics in the private healthcare system in terms of the public providers. And if children, or the cost in terms of children is about a third, and they should actually lose that, wouldn't private sector need to change themselves and make it more affordable? Now, why do we buy medical schemes? We buy because we are scared to go to the public facilities. Now, if these type of public facilities are built with this quality, will it not change the way that medical schemes act? And where the purchasing is now not because of fear, but because I actually now see value. And I think that is exciting for South Africa. It's not only about providing care and cover for the people that currently is uncovered, but it's actually a revolution in the healthcare industry, where the private sector will also need to change the way they do it, and they cannot any longer rely on the fear factor, and they need to provide us with quality and value. And I think that is exciting for South Africa. And for that reason, AON is privileged to be part of this process. This process in South Africa at this stage is really, I think, the most exciting time for AON. And AON wants to contribute to this process enormously.
Great. Thank you very much, Andre. Thank you for your time.
Okay.
Thanks.